Hi, Catherine here. Video number 8. Maintaining serenity after surgery. I had my husband take a little video clip from the hospital. This is the third day from my surgery, and I'm starting to be coherent again. I feel a lot better. The first day was insane. I felt like I was trapped in a body that I can't make it do anything that I wanted to, and it hurt. But they gave me this pain medication, which made it hard for me to stand up because anesthetics and numbing or pain meds and any sort of numbing medicine usually makes me dizzy, and it's important to walk. So it's kind of a catch-22. So today I decided I want to go home, so they won't let me go unless I walk. So I said I'm just going to not take the pain med so I can get up and walk without the rooms having to turn around. As you can see, I'm still alive. Surgery day was February 10th. That was day 1 at the hospital, and it was mostly a blank. Thank you to anesthesia. We had checked in at 5 a.m. at the hospital, and we waited a while before they called us into the pre-surgical prep room, where we waited for each team of doctors, interns, and residents to come and, I guess, debrief us on what's going to happen. I saw a little baby in there, and that was very sad for me to see that. Last thing I remember for that day was saying goodbye to my husband as they wheeled me off while my consciousness just got taken away by the anesthesia. So I woke up in my hospital room to a nurse trying to wake me up. I had insisted on sending my husband home to my son, who might be worried. So my college roommate buddy offered to stay with me for the duration, which is really sweet and kind. She told me that it was already day 2 of my hospital stay, and that previous day after the surgery I had stayed in the recovery room for 8 hours instead of the 1 to 1.5 hours that I was supposed to, and worried a lot of people that came and to visit, and apparently I had conversation with, but don't remember. I'm so sorry. I stayed 4 days and 4 nights at the hospital. Seemed like an eternity, yet half of it was unconscious. How does that add up? So I also want to thank all the doctors that made their rounds daily, and interns, residents worked hard to learn, and the nurses who are my beautiful angels who took perfect care of me. Thank you so much. You are great. You're like the heart of the hospitals. Thank you. And you also worked the hardest. I really appreciate that. Oh yeah, and the morphine drip that I got to click, that was very helpful too. Thank you. The walks were not easy, but my college buddy told me that I don't get my get out of jail free card unless I walk a few times. Then rises the mind of the inner warrior over the body of the princess and the pea. Oh, to the nearby patient that was mean and rude to all the very nice nurses, throwing stuff at them and yelling. Yeah, I can hear you. You might want to consider a different way to ask for help. Just saying. On February 14th, yeah, Valentine's Day, I waited like half a day to try to get discharged from the hospital. And I have bought this vest. I don't know if you can see this vest that I'm wearing right now, that has drain pockets on the inner side, which I bought online beforehand. And I wore it home, and it took us 2 hours to get through the traffic, and we're pretty sure it's because it was Valentine's Day. But I was really, really happy to be home. And we came home that night to this so gorgeously cooked, it tastes so good, steak dinner with all the trimmings and dressings from a very dear friend who's apparently a gourmet cook too. That was the best day. And thank you, Lisa, for starting the meal train. It was so wonderful. And everybody else too. The second day home, February 15th, was when my world turned upside down, literally. I was given oxycodone and nausea pill to prevent nausea from the pain narcotic meds. These were not meant to be taken on an empty stomach, and no lag times in between the pills. Now, at one point, after I got home, of course, I somehow got off that wagon of the perfect clockwork that the nurses put me on, and I started to puke my guts out, and it felt like I had tore my stitches from the puking. But luckily, those suckers are a lot stronger than they felt. Thank you, surgeons. I spent the rest of the days trying to figure out how to get back on that no pain zone with different amounts of oxycodone and the nausea pill that was supposed to be getting rid of nausea ended up causing like the worst nausea. That's like the antipsychotic drugs. The side effects is psychosis. Doesn't make any sense, but you know what? It was so bad. The nausea at one point escalated to the point where I started to have this strong, bad vertigo and vomiting. It was awful. And so I'm supposed to have 11 ounces of protein a day. I don't eat that much protein normally. With this vertigo, there's no way I can get even like 1 gram of protein in. As of yesterday, which is February 18th, I got tired and frustrated of puking and not being able to not have vertigo. And I called my breast surgeon and she called me right back. So nice. And thank you. We agreed. My body has just been pretty clean. I'm not on any medication. I don't do drugs. I don't drink since it gives me hives. Found that out in college. It just had this major reaction. Didn't want it anymore, I guess. So usually my choice of pain med, over the counter, Motrin, which is ibuprofen. But I can't have it because it's a vasodilator. I can't have coffee, caffeine either because it's a vasoconstrictor. As opposed to ibuprofen, neither is good. Because remember, the reconstruction surgeon moved the capillaries from my tummy to up here to encase the new fat. But it's like it's not really new. I grew it. The breast surgeon gave me 2 options basically. One is to get food into my tummy and restart the process of oxycodone and nausea pill, or just to take Tylenol. I decided to cut the narcotic pain pills because I figure at some point I have to come off of them again and it's just no fun at all. So I figure, okay, let's try this. Let's cut out all the oxycodone and the nausea pill and take the Tylenol the breast surgeon suggested and see what happens. I did that yesterday morning, and by last night I of course had excruciating pain because I have 3 drains that's connected to my body with holes and also the stitches. But I did not have nausea, vomit, or vertigo, which was the worst. So I'll take pain over the vertigo any day. And then I took some Tylenol and it took the edge off the pain a little so that I can eat through the pain. And I had food. I had dinner for the first time since that first night home. I was also lucky to have a long visit with a very old friend that turned my painful day into a very warm and memorable evening. So thank you, Keiko. So this morning, after having eaten a full dinner and a fairly decent sleep, I woke up this morning and I pooped. After 9 days of not pooping. Yay! Then the home care nurse came. She was also very nice. So she took all my vitals. I'm apparently very healthy. This is a good time to tell you that there has been no surprises. The surgery was everything they expected to be. They got rid of the cancer and with the breast. The notes that they removed to test to make sure that it's cancer free, the nodes, and they were, which means that the odds are it did not leave the breast area. Tomorrow I have an appointment to go see my reconstruction surgeon, and I'm gonna tell him that I'm not leaving until he moves the drains. Think it'll work? Okay, I'm kidding. But you know what though? I've been reading that if it's... Okay, I can't talk fast. If the drains are below 30 mils per jar, most doctors are okay moving it. There's gotta be a better way. I'm gonna work on that. Drains hurt. Because the stitches are in my abdomen, I have to slouch as I walk. We want them to not have too much pressure of pull. I know y'all be so disappointed to see all this super sexy new look for me go. Bye bye, Lady Drano meets Urkel. Because I'm forced to walk like Urkel.